All right, let's talk about something incredibly high stakes. In a major burn emergency, time is literally your enemy. Today, we're going to break down a simple but ridiculously powerful tool that helps first responders make life or death decisions in seconds. It's called the Rule of Nines. So picture this. A patient is rushed into the ER with severe burns. The clock is ticking loud. One of the very first most critical questions you have to answer is how much of the body is actually affected, because that answer is going to dictate everything you do next. And the answer, believe it or not, isn't some crazy, complex calculation. Nope, it's an elegant, brilliantly simple tool that clinicians have been relying on for decades to save lives. Okay, so before we dive into the rule itself, we need to get crystal clear on the one piece of information we're hunting for. It all boils down to this one thing: TBSA, or total body surface area. It's just a fancy way of saying what percentage of the body got burned. Getting this number is the absolute critical first step because it tells us exactly how much fluid we need to pump into the patient to stop them from going into a deadly condition called burn shock. All right, now for the main event, let's get into the rule itself. Think of it like a mental shortcut. A quick and dirty body map that lets you estimate that burn percentage on the fly. And here's the beautiful part about the Rule of Nines. It is so simple. It just breaks the adult body up into sections that are worth either 9% of the total or a multiple of 9. Let's go through it piece by piece. So let's start from the top. The entire head and neck altogether counts for 9% of the body's surface area. Now, if it's just the front that's burned, that's 4.5%. Just the back, you guessed it, also 4.5%. Simple, right? Okay, next up, the arms. Each entire arm, we're talking from the shoulder all the way down to the fingertips, is another 9%. So if your patient has burns covering their whole left arm, you just add 9% to your running total. And just like the head, you can split it. 4.5 for the front, 4.5 for the back. Now, when we get to the legs, things get bigger. The percentage actually doubles here. Why? Well, because they have a lot more surface area. So each full leg is worth 18%. And that breaks down pretty neatly into 9% for the front of the leg and 9% for the back. And now for the big one, the torso. The entire front of the torso, so your chest and your abdomen, that's 18%. Flip them over, and the entire back is another 18%. So the whole trunk of the body makes up a massive 36% of the total. And that brings us to the final tiny piece of the puzzle. The perineum, or the genital area, makes up that last 1%. Yeah, it's a small percentage, but hey, in a full assessment, every single percent counts. So you see how it all comes together. The entire body map is just built on these multiples of 9. You add up the sections: 9 for the head, 9 for each arm, 18 for each leg, 36 for the torso, and you get a super fast estimate of that TBSA. Now here's a really important catch. This system is designed for adults. Kids have totally different body proportions, so we use a different chart for them. But for an adult in an emergency, the Rule of Nines is your go-to. Okay, so we have our TBSA number. So what? What do we actually do with it? Well, this is where it gets life or death. See, when a huge part of the skin is burned, the body's tiny blood vessels, the capillaries, they start to leak. Fluid just pours out of the bloodstream. That leads to a massive drop in blood pressure, and organs start to fail. That's burn shock. And that TBSA number we just calculated, that is our weapon to fight it. That percentage we just figured out is the magic key to unlocking something called the Parkland formula. This formula is the gold standard for figuring out exactly how much IV fluid a burn patient needs over those first 24 hours after they get injured. It is absolutely critical. I know, it looks like a math problem, but trust me, it's just a simple recipe. 3 easy steps. Step 1, you need the patient's weight in kilograms. Step 2, grab that TBSA percentage we just got from the Rule of Nines. And step 3, you just multiply 4 milliliters times their weight in kilos times that TBSA number. And boom, that's the total amount of fluid you'll need. So, getting those fluids right is the absolute #1 priority in that initial emergency phase. But once the patient is stable, the whole game changes. The focus makes a huge shift toward the long, long road to recovery. You've really got to think about burn care in 2 totally different phases. First, you've got the emergency phase. That's all about survival, right? Managing fluids, stopping shock. But then you have the rehabilitation phase. And this part only begins after the burn wounds have completely closed up. This phase can last for months, sometimes even years, and it's all about getting function back and making life as good as it can be. Now, here is a key distinction, and for anyone studying for the NCLEX, you're going to want to listen up because this is a big one. Of course, infection is a huge risk when the wounds are open, but in the rehabilitation phase, after that skin barrier has closed back up, the main risks are different. That is a super common trick question on exams, so don't fall for it. So as we move into that long-term healing phase, what are the key things we need to teach our patients to help them on that journey? Well, here are some really high-yield tips that are not only perfect for patient education, but are also total gold for your nursing exams. And to make it super easy to remember, we've got a little mnemonic for you, WWE. The first W stands for water-based lotion. That new skin is super fragile, and you gotta keep it moisturized. The second W is for wearing pressure garments. These are special tight clothes that put constant pressure on the scars to help them heal flatter and softer. And finally, E is for exercise. Daily range of motion exercises are a must to keep the joints from getting stiff and locking up in a condition called a contraction. And that really brings us full circle, doesn't it? The rule of nines, the Parkland formula, these are amazing, powerful tools for that first 24 hours. But the real challenge, the real work, happens in the weeks and months that follow. So yeah, you've mastered the numbers, but the bigger question is, how do you